Golden Hill Cemetery in Lakewood has its place in history. At the turn of the 20th century, the old landmark became a resting place for Orthodox Jewish patients that died from tuberculosis. More than 100 years later, and 20 miles down the same road, TB is still a topic of conversation.
We don't know for sure, but certainly multiple factors have contributed to an increase in cases.
Dr. Larissa Pisney is a medical director of infection prevention at UC Health. Over the last year, the hospital says the state has seen a nearly 60% increase in TB cases. In 2022, the state reported 57 cases. So far, doctors have seen 84 cases with 2 deaths.
Tuberculosis is the deadliest infectious disease worldwide. So more than 10 million cases a year and 4,300 deaths a year. While rare in Colorado, it's still very important for us to think about it, particularly in the right patient.
Not thinking about it may be one of the reasons why Colorado has gotten here. Pisney says many of the cases have been unique, and that's likely because of a delay in care or potentially early symptoms being missed. With a common sign being a cough, experts may think it's something else.
This one, you have to order very specific tests to find it. And so the clinician has to be thinking about it to make the diagnosis.
Pisney hopes more doctors keep it top of mind this year as they grapple with a historic disease in a modern world.
If you didn't think public health was important before, the spread of TB cases certainly highlights that.
According to the state health department, 8 of the 84 cases this year were in people younger than 18 years old. Many of the cases came from the Denver metro area as well as El Paso County, which is similar to recent years. And Tom, TB was on a 10-year decline here in Colorado until this year.
She talked about having to be on the lookout for it, though. It's probably falling more to the health community than to parents, so you may not spot it unless you are an expert.
Exactly. That message, I think, was specifically for the health community because it's not top of mind, right? It's a fairly rare disease, but the reality is we're seeing it more here. So she wants to make sure that individuals who do care for patients are thinking about it when they're running through some tests.
And we'd like to make it more rare again. All right, Jaleesa, thanks.